And the next presenter is Joseph Fokam, who will go through archived HIV-1 drug-resistant variants in cellular reservoirs and its determinants among vertically infected adolescents failing antiretroviral treatment.
The study we are about to present is entitled Archived HIV-1 Drug Resistance Variants in Cellular Reservoirs and its Determinants among vertically infected adolescents failing antiretroviral therapy in Cameroon. Briefly, there is an overall decreasing mortality of HIV in all age range, except for the age of adolescents, where we are seeing an increasing rate of mortality. In the Cameroonian context, where we have 3% HIV prevalence, we still have more than 10% mother-to-child transmission, indicating that these children born with HIV going towards adolescence might experience therapeutic challenges as well. Viral suppression among adults is 80% as compared to 55% in adolescents, and adolescents failing antiretroviral therapy have higher rates of harboring HIV drug resistance mutation. In this context, we raise the following hypothesis. Drug resistance mutation may fade up as children with perinatal infection grow up, and those harboring archived drug resistance in cellular reservoir might have a high rate of treatment compromisation in future. As study objective, we seek to compare the mutational profile of HIV drug resistance mutation between circulating RNA and proviral DNA among those failing treatment, and to study the determinants of archived drug resistance mutation in these adolescents. To address this objective, we carried out a comparative assessment among 296 adolescents vertically infected receiving antiretroviral therapy in 5 treatment sites in Cameroon, and we did clinical assessment and self-reported adherence, CD4 and viral load were measured for all participants, and we compared the RNA and coviral DNA genotyping for those having high viral load. In a nutshell, out of 296 that were enrolled, we had at the end 48 with both RNA and DNA sequences that were eligible for the study. These were adolescents with a median age of 16, similar sex ratio, 5 log in terms of viremia, and half of them were at advanced disease progression. Treatment duration was 8 years, with majority of them being on NRTI-based reading. Sequences comparison between RNA and DNA showed 100% concordance, thereby indicating reliability in the quality of sequences. CRF0280 was the most prevalent, and we also have 2 potential recombinants. Drug resistance mutations were higher in RNA as compared to proviral DNA, especially for NRTI and NNRTI mutations. And in terms of drug mutations by class, we had M184V more prevalent for NRTI, with T69N being more prevalent in proviral DNA. For NNRTI, we had K103N being more prevalent in plasma, whereas V106 and M230 were more prevalent in proviral DNA. As you mentioned, PI were similar in both compartments. Finally, the presence of drug resistance higher in plasma as compared to proviral DNA showed a significant disparity. Concordance mutation between RNA and proviral DNA was in less than 40% of participants, driven by a WHO stage 1 and 2, and archived drug resistant mutation found only in proviral DNA were seen in about 25% of adolescents. And archive of this drug resistant mutation were driven by an advanced clinical staging and also very poor CD4 count. Thereby, OCO drug resistant mutation is driven by advanced clinical staging and CD4 naive. In conclusion, about 1/3 of adolescents are experiencing antiretroviral therapy failure, plasma represents a more sensitive biological specimen for drug resistance analysis in clinical settings. However, archived drug resistant mutations are found in about one quarter of these adolescents, driven by advanced clinical stages and severe immunodeficiency. And in future, we will seek therefore to compare the resistance profile between those with high and poor viral load, as well as characterizing the viral reservoir size, comparing immune activation, and performing HIV functional cure studies in this population. We would like to thank ECTP and the various partners who supported this work at the level of Cameroon. Thank you for your kind attention.